Mrs. Lyle?
Yes.
How are you today?
I'm well. How are you?
I'm good. My name is Madison. I'm a nurse practitioner student. Today we're going to be doing an assessment of your abdomen and your blood vessels. Does that sound okay to you?
Sure.
Okay. I'm going to first lift up your shirt. My hands might be a little cold. Alright, I'll keep it broad. Alright. So at first inspection, the patient's stomach is the same skin tone as the rest of her body. It is symmetrical. There are no veins that are able to be tested for venous return. Her abdomen is symmetrical, and the surface motion is also symmetrical. I'm going to have you raise your head without using your arms. Hold it for a second, and then you can go back down. I'm just going to look to see if there's a... Go ahead. You're good. When she raised her head, there was no masses, hernia, or separation of muscles noted. Now I'm going to take my stethoscope, and I'm just going to listen to all quadrants of your valve.
Sorry, I have the arms.
They're normal active bowel sounds. Now I'm going to also take your carotid, abdominal aorta, renal, iliac, and femoral arteries for bruits using the bell of my stethoscope. Starting with your aorta. These are your left and right renal, left and right iliac, and then left and right femoral. And I'm also going to listen to your Now I'm just going to percuss all of the quadrants of your abdomen. Good. Now I'm going to, I can pull your shirt down. I'm going to percuss to estimate the size of your liver borders. Let's make this difficult. Due to the patient having a bra and getting her liver border size is very difficult. Now I'm going to palpate your spleen. Good. And then for any gastric air bubbles. Good. Next, I'm just going to lightly palpate all quadrants for any muscle resistance, tenderness, or masses. Let me know if there's any pain. Do you feel any pain?
No.
Good. Okay, now I'm going to do some deep palpation. Let me know once again if there's any pain. I'm going to do around your umbilicus and umbilical ring. Is there any pain?
No.
Okay, now I'm going to have you. I'm going to hold that here. I'm going to have you take a big deep breath in and hold it and out. Good. That was to feel the liver border. Now I'm going to palpate the gallbladder. I'm going to have you do the same thing. Go ahead and take a big deep breath in and out. Good. Now I'm going to palpate your spleen. Go ahead and do the same thing and out. Good. And then I'm going to do it with your kidneys. All right, go ahead. And out. Good. And one more time. Perfect. I'm just going to palpate for any aortic pulsations, and there are none noted. There are no other masses noted on palpation either. So now I'm just going to take a look at your blood vessels. I'm going to take a look at your arteries and veins. So I'm going to feel your pulses starting with your carotid, but your carotid arteries are always palpated one at a time. Good. Now your brachial arteries. Good. And your radial. Perfect. I'm just going to feel behind your legs. For your good. All pulses, including her carotid, brachial, radial, popliteal, posterior tibial, and pedal pulses, are all equal bilaterally. Bilaterally.
That's a lot to say.
That was a tongue twister. Now I'm going to test your jugular pulsation and jugular distension. So what I'm going to have you do is I'm going to take this pillow, go ahead and lay back down. Good. So then I'm going to have you gradually raise your head. I'm going to be looking for pulsations in your neck. It's typically around your chin and your jaw. If you can slowly do that, once I see the pulsation, I can put a pillow on your head. That way it's uncomfortable. If you can just slowly raise up for me. Good. All right. That's about perfect. So then I'm going to take a ruler at your mid-axillary level with the nipple. Once again, difficult with breast. Pulsation. Good. And we are at 7 centimeters, which is perfect because less than 9 centimeters is normal. So I'm just going to kind of take a look at your arms and your legs, looking at your veins. There are no abnormalities to her arms, no abnormalities to the veins in her legs, no varicose veins. Her nails appear to be good. There's no clubbing noted. There's no edema, no muscular atrophy. Her hair is well distributed. Her skin is warm. Her pulses are regular. They're not bounding. They're not soft. There's no pitting edema, and there was no tenderness upon palpation. Miss Lau, do you have any questions?
I do.
All right. Thank you for your time.
You're welcome.